Hi, my name is Ashley Odsko. I'm a P4 student from UTHSC College of Pharmacy, and I'm Dr. Katie Vandenberg's P4 student for the month of November. And today I'm going to be presenting on how Tennessee Vaccination Services can provide the COVID-19 vaccine in correctional facilities. So I first wanted to start off by defining the difference between a jail and a prison. So jail is typically short-term, about a year or less, and it's typically people who are awaiting trial, sentencing, or those who have committed minor crimes. Typically, jails have fewer security measures compared to prison, and they're typically operated by their local government, such as their local police and sheriff's department. Prison is typically longer than a year, and it's typically those convicted or sentenced to more serious offenses. Depending on the facility, they can either have low or high security, and these are often ran by their state or federal authorities and can sometimes be ran by privately owned companies. So that kind of moves me into, I wanted to give an overview of how many people are incarcerated in the United States, as well as here in Tennessee. So in the United States, we currently have about 1.9 million people who are incarcerated. As of last year, 2022, there were about 25,579 people incarcerated in jails here in Tennessee. And as of this year, we have about 19,694 people in prison in Tennessee. So as you can see here in the state of Tennessee, we have quite a lot of people who are currently incarcerated. So that moves me into the facilities here in the state of Tennessee. So there are 95 counties across the state of Tennessee. In those 95 counties, we have 112 jails. We have 14 Tennessee Department of Correctional Facilities, which are our prisons. And of those 14 Tennessee Department of Correctional Facilities, we have 4 that are owned by CoreCivic, which is a privately owned company. So who's funding and owning these facilities? So typically local counties, states, or privately owned companies. So that moves me into discussing the privately owned companies. There's several across the United States, but the big two are CoreCivic and GEO. CoreCivic is the largest across the United States. Their headquarters are located here in Nashville, Tennessee, and GEO is the second largest, and their headquarters are located in Boca Raton, Florida. So I wanted to give an overview of all of the facilities that CoreCivic currently owns across the United States. So currently they have 74 facilities, and we have 4 of them here, like I mentioned earlier, in the state of Tennessee. GEO, as you can see, definitely has far less facilities compared to CoreCivic. And currently there are no facilities here in the state of Tennessee. Next here, I have a map of the state of Tennessee, and I have this here so that you can see the different counties across the state. So everywhere where there's a red pin, that means there is either a jail or a prison in that county. The only county that does not have a jail or prison is Pickett County, and it is located at the top of Region 2, where I have the green arrow pointing at. Tennessee Vaccination Services, we are here in Middle Tennessee, which is in Region 3, and I have the star to designate our region. And the interesting and cool part about that is here in Region 3, there is a jail or a prison in each of those counties. So that leads me into the Tennessee Department of Correctional Facilities. So I have them listed here, West, Middle, and East Tennessee. And so West Tennessee, we have the Hardeman County Correctional Facility, the Mark Luttrell Transitional Care, Northwest Correctional Complex, and the West Tennessee State Penitentiary. In Middle Tennessee, here where we're located, we have the most number of Tennessee Department of Correctional Facilities. We have the Deborah K. Johnson Rehabilitation Center, the Lois M. D. Bowery Special Needs Facility, the Riverbend Maximum Security Institution, the South Central Correctional Facility, the Trousdale Turner Correctional Center, the Turney Center Industrial Complex, and the Whiteville Correctional Facility. Of Middle Tennessee, the Deborah K. Johnson, Lois M. D. Bowery, and Riverbend, they are all located here in West Nashville. And in East Tennessee, we have the Bledsoe County Correctional Facility, Northeast Correctional Complex, and the Morgan County Correctional Facility. So that leads me into my list of the core civic facilities located here in Tennessee. We have the Hardeman County Correctional Facility in Whiteville, Tennessee, the South Central Correctional Center in Clifton, Tennessee, Trousdale Turner Correctional Facility in Hartsville, Tennessee, and the Whiteville Correctional Facility located also in Whiteville, Tennessee. So that moves me into the grant changes. So due to the COVID-19 vaccines now becoming commercialized and no longer government funded, we can no longer vaccinate patients with insurance. So due to that, it's made it very challenging for us to be able to give vaccines to patients. Most of the patients that we can vaccinate are the homeless, undocumented citizens, and patients who are incarcerated. So I wanted to touch on COVID-19's effect on the facilities across Tennessee. So from February of 2020 to April of 2022, the jail population in Tennessee decreased by about 14.3%. From January of 2020 to September of 2023, the prison population decreased by 9.8%. And so I have those here to kind of break that down as to why they have possibly decreased. So during the height of COVID, state prisons in Tennessee had some of the highest outbreaks in cases of COVID-19. Due to that, those inmates were transferred from their prisons to the local county jails, which then caused a higher increased infection rate in those county jails. And sadly, some of the inmates passed away from COVID-19, or their facilities became too infected with COVID. So then patients or inmates were then transported to other facilities across the state. Since people in jails and prisons are in close quarters, they are going to be at an increased risk of contracting diseases without vaccination. And I also wanted to mention too on this to think about patients in jails and prisons. They're exposed to different officers each day, different administrative staff, different healthcare staff, and those people are exposed to the outside every single day. And since they're coming in and out of the jails every single day, they're exposing the people in jail and prisons to whatever they've been exposed to on the outside, which is even more reason that these patients need vaccines, and it could have been another cause of the increase of infection of our incarcerated patients. So that leads me into who's actually providing the new COVID vaccines to our patients who are incarcerated. So after I've spoken to several health directors at the health departments and medical staff in the jails, currently no one knows who is providing or going to provide funding for the new COVID vaccines. Previously, as we know, they were government funded. And just in general, I wanted to kind of briefly touch here that jails and prisons typically receive funding from their local county, state, and sometimes federal government for their patients' health care. And so kind of to wrap this up here, I was able to have a very good conversation with one of the medical directors of a few of the health departments, and she was able to tell me even too, with the new updates, they are also not able to give the new COVID vaccines to patients with insurance. So this kind of helps bring back the question of where is the funding going to come from for these new vaccines for these people who are incarcerated. And so here I have a list of the different health departments that I contacted and their medical directors and their answers as to who is providing or who's going to provide these vaccines for their patients. And as you can see from my chart, literally nobody knew who was going to provide funding. Currently, nobody has any idea. They haven't heard anything. So they currently have no idea who is actually in the future going to be providing the funding for these vaccines for patients incarcerated. I was, however, able to be provided with a pharmacist for the state of Tennessee, or for Middle Tennessee specifically, excuse me, by one of the health department directors. And she was able to tell me that the pharmacist for Middle Tennessee, his name is Dr. Stephen Lewis, and I have his phone number listed here. I reached out and tried to contact him. However, I was not able to reach him. So I'm not sure if he has any information, or he might have some information on maybe something in the works. But this was a resource that I was provided from someone. And so ultimately, how can we help as Tennessee Vaccination Services for the patients who are incarcerated? One, we can help save on funding by providing the vaccines so the facilities are not having to buy the vaccines for their patients or wondering where they're going to get their vaccines from. Two, our services that we're providing would be free. So the facilities would not have to have additional people providing vaccines, and it would also lessen the stress of the healthcare staff currently at the facilities. They are very busy every day dealing with many patients, and they have many different tasks to complete. And if we could just provide one less thing that they have to worry about, that would be a wonderful thing for them. Three, since our services are free, the facilities would not have to pay us a dime for our services at all. And lastly, we can help vaccinate more inmates to ultimately ensure their health and their safety, which is the overall goal. Please let me know if you have any questions, and I really appreciate your time.